Normally, red blood cells are shaped like discs, which gives them the flexibility to travel through even the smallest blood vessels. However, with the disease sickle cell, the red blood cells have an abnormal crescent shape resembling a sickle. This makes them sticky and rigid and prone to getting trapped in small vessels, which blocks blood from reaching different parts of the body. Hello and welcome to Microbiology Insider. If you are new to this channel, I do videos about diseases caused by microorganisms and microbiology lectures in general. Before I ride on, please do endeavor to hit the subscribe button and turn on your notifications so whenever I upload a video, you'll be the first to know about it. In this video, I will be covering the following objectives. What is sickle cell anemia? The symptoms of sickle cell anemia, types of sickle cell anemia, causes of sickle cell anemia, what complications can arise from sickle cell anemia, how sickle cell anemia can be diagnosed, and how sickle cell anemia can be managed and treated. Sickle cell anemia is one of a group of inherited disorders known as sickle cell disease. It is a genetic disease of the red blood cells. Sickle cell disease is an autosomal recessive condition. You need 2 copies of the gene to have the disease. If you have only 1 copy of the gene, you are said to have sickle cell trait. First symptom we will be looking at is anemia. Sickle cells break apart easily and die. Red blood cells usually live for about 120 days before they need to be replaced. But sickle cells typically die in 10 to 20 days, leaving a shortage of red blood cells. Without enough red blood cells, the body can't get enough oxygen, and this causes fatigue. Secondly, we have episode of pain. Periodic episodes of extreme pain, called pain crises, are a major symptom of sickle cell anemia. Pain develops when sickle-shaped red blood cells block blood flow through tiny blood vessels to your chest, abdomen, and joint. We also happen to have swelling of hands and feet. The swelling is caused by sickle-shaped red blood cells blocking blood circulation in the hands and feet. Next, we have delayed growth or puberty. Red blood cells provide the body with the oxygen and nutrients needed for growth. A shortage of healthy red blood cells can slow growth in infants and children and delay puberty in teenagers. Vision problem happens to be another symptom. Tiny blood vessels that supply the eyes can become plugged with sickle cells. This can damage the retina, the portion of the eye that processes visual images, and lead to vision problems. Sickle cell also causes jaundice, which causes the yellow coloration of the eye. Sickle cell anemia is caused by a change in the gene that tells the body to make the iron-rich compound in red blood cells called hemoglobin. Hemoglobin enables red blood cells to carry oxygen from the lungs throughout the body. The hemoglobin associated with sickle cell anemia causes red blood cells to become rigid, sticky, and mishappen. For a child to be affected, both mother and father must carry 1 copy of the sickle cell gene, also known as sickle cell trait, and pass both copies of the altered form to the child. If only one parent passes the sickle cell gene to the child, that child will have the sickle cell trait. With one typical hemoglobin gene and one altered form of the gene, people with the sickle cell trait make both typical hemoglobin and sickle cell hemoglobin. Their blood might contain some sickle cells, but they generally don't have symptoms. They are carriers of the disease, however, which means they can pass the gene to their children. Hemoglobin is the protein in red blood cells that carries oxygen. It normally has 2 alpha chains and 2 beta chains. The 4 main types of sickle cell anemia are caused by different mutations in these genes. The first type of sickle cell disease we will be looking at is the hemoglobin SS disease, which is the most common type of sickle cell disease. It occurs when you inherit copies of the hemoglobin S gene from both parents. This forms hemoglobin known as HbSS. As the most severe form of sickle cell disease, individuals with this form also experience the worst symptoms at a higher rate. Hemoglobin SC disease is the second most common type of sickle cell disease. It occurs when you inherit the hemoglobin C gene from one parent and the hemoglobin S gene from the other. Individuals with hemoglobin SC have similar symptoms to individuals with hemoglobin SS. However, the anemia is less severe in SC as compared to that in SS. Thirdly, we have hemoglobin SB+. Hemoglobin SB+ thalassemia affects beta globin gene production. The size of the red blood cell is reduced because less beta protein is made. If inherited with the hemoglobin S gene, you will have hemoglobin S beta thalassemia. Symptoms are not as severe. Sickle beta 0 thalassemia is the fourth type of sickle cell disease. It also involves the beta globin gene. It has similar symptoms to hemoglobin SS anemia. However, sometimes the symptoms of beta 0 thalassemia are more severe. It is associated with a poorer prognosis. We also have hemoglobin SD, hemoglobin SE, and hemoglobin SO. These types of sickle cell disease are more rare and usually don't have severe symptoms. Sickle cell trait. People who only inherit a mutated gene from one parent are said to have sickle cell trait. They may have no symptoms or reduced symptoms. The following are types of complications that can result from sickle cell anemia. Firstly, we have neurological complications. Seizures, strokes, or even coma can result from sickle cell disease. They are caused by brain blockages. Immediate treatment should be sought. Secondly, we have delayed growth. Delayed growth often occurs in people with sickle cell disease. Children are generally shorter but regain their height by adulthood. Sexual maturation may also be delayed. This happens because sickle cell red blood cells can't supply enough oxygen and nutrients. We also have eye problems. Blindness is caused by blockages in the vessels supplying the eyes. This can damage the retina. We also have heart disease and chest syndrome. Since sickle cell disease interferes with blood oxygen supply, It can also cause heart problems, which can lead to heart attacks, heart failure, and abnormal heart rhythms. Lung disease. Damage to the lungs over time related to decreased blood flow can result in high blood pressure in the lungs and scarring of the lungs. These problems can occur sooner in patients who have sickle chest syndrome. Lung damage makes it more difficult for the lungs to transfer oxygen into the blood, which can result in more frequent sickle cell crises. We also have hand-foot syndrome. Hand-foot syndrome occurs when sickle-shaped red blood cells block blood vessels in the hands or feet. This causes the hands and feet to swell. It can also cause leg ulcers. Swollen hands and feet are often the first sign of sickle cell anemia in babies. We also have priapism. Priapism is a lingering, painful erection that can be seen in some men with sickle cell disease. This happens when the blood vessels in the penis are blocked. It can lead to impotence if left untreated. Lastly, we have gallstones. Gallstones are one complication not caused by a vessel blockage. Instead, they are caused by the breakdown of red blood cells. A byproduct of this breakdown is bilirubin. High levels of bilirubin can lead to gallstones. These are also called pigment stones. Sickle cell anemia can be diagnosed by one of the following methods. Several blood tests can be used to look for sickle cell disease. Blood counts can reveal an abnormal hemoglobin level in the range of 6 to 8 grams per deciliter. Blood films may show red blood cells that appear as irregularly contracted cells. Sickle cell solubility tests look for the presence of hemoglobin S. Hemoglobin electrophoresis is always needed to confirm the diagnosis of sickle cell disease. It measures the different types of hemoglobin in blood. The following are methods by which sickle cell anemia can be treated. Firstly, we have rehydration. Rehydration with intravenous fluids helps red blood cells return to a normal state. The red blood cells are more likely to deform and assume the sickle shape if you are dehydrated. Secondly, we have blood transfusion. Blood transfusions improve transport of oxygen and nutrients as needed. Packed red blood cells are removed from donated blood and given to patients. We also have supplemental oxygen. Supplemental oxygen is given through a mask. It makes breathing easier and improves oxygen levels in blood. Droxia and Hydra are drugs which helps to increase the production of fetal hemoglobin. It may reduce the number of blood transfusions. We also have bone marrow transplant. Bone marrow transplant has been used to treat sickle cell anemia. Children younger than 16 years of age who have severe complications and have a matching donor are the best candidates. We've come to the end of this video. Before you leave, please do endeavor to hit the subscribe button and turn on your notification so whenever I upload a new content, be the first to know about it.